I'm just going to talk very briefly about a piece of work that Cochrane's been doing, which I hope shows that it is possible in the middle of this pandemic to involve patients, the public, or consumers, as Cochrane calls them, in research. So I'm going to talk about Cochrane's work to involve consumers in rapid reviews of evidence. So if I could have the next slide, please. I'm just going to say that I don't have any conflicts of interest, but I'd also especially like to thank the members of the Consumer Rapid Response Task Group that came together to develop this work that I'm going to describe to you now. So you can see the names of the members of that group here. And Maureen is, who's you're going to hear from later, is one of that task group. So thank you very much to that task group. It's been a privilege to work with them, and I'm describing our work. So if I could have the next slide. Thank you. So I'm just very briefly going to talk a little bit about the history of consumer involvement in Cochrane, and a little bit about Cochrane's response to COVID-19, how we formed this Consumer Rapid Response Group, and what the group's work about the group's work to date, what we've achieved so far, and then just like Jeremy, I'm going to have a few reflections on what I think contributed to the success of this, and that might be of interest in the later discussion when we think about the post-COVID world. So if I could have the next slide. Thanks. So consumer involvement in Cochrane has been happening for a long time, essentially since the formation of Cochrane in 1993, and the Cochrane Consumer Network, a community of patients, caregivers, members of the public, people who advocate for patient involvement. That network was formed in 1994, and currently it has over 1,700 members around the world in 80 countries. These are people who volunteered to support patient involvement in research. And so that's, I think that's quite a significant and unique feature of Cochrane's work. The things that those people do are very many and varied. The key core things are that consumers will work with author teams who are conducting the research, so they'll work alongside them to support the production of that research. They also peer review the work that those author teams produce. In fact, consumer contributions to peer review, that's the most commonly performed task, if you want to describe it in that way, that consumers do. They're also involved in the dissemination of evidence, and that's a growing piece of our work because it's important that Cochrane evidence gets out into the world and informs people who have to make difficult decisions about health treatments. And the other thing is that they're involved in the governance of Cochrane as well, and that's a key part of their work and something I'll touch on shortly. So the next slide, please. So for those people who haven't come across Cochrane before, there's a really good quote from the UK's Guardian here, and which describes Cochrane's work, how it summarises the findings of research so that people making important decisions, and that includes healthcare consumers, can access unbiased information. That's what Cochrane does, and you can find more about that, about Cochrane, on the cochrane.org website. Once the pandemic was declared, Cochrane made responding to the COVID-19 crisis its priority. And you can see from that infographic there that it's been doing a lot of work to get evidence into the hands of people who need it at this difficult time. And so you can see that Cochrane's published special collections, 6 special collections of research. It's published 4 rapid reviews. Those rapid reviews, they're the first in a long number of rapid reviews that will be published, and I'm going to talk a little bit about that shortly. Not all the evidence that Cochrane is publishing is in the form of rapid reviews. Some of it are fast-tracked existing reviews, that it's been undertaking. So it's published so far to date, one of those. And then we're also translating this evidence into different languages so that our global audience can access it in languages other than English. That's Cochrane's response to the pandemic. Could I have the next slide, please, Oliver? So it's important in producing that research that consumers could be involved in that process. It's really important for all kinds of reasons. And that involvement of healthcare consumers is Cochrane policy. We have a statement of principles which guides our work in this area, and we'll be sharing these slides later, and you can see a link to Cochrane's statement of principles. You will be able to do that. The guidance to author teams and others in Cochrane about the production of rapid reviews also states very clearly that the stakeholders in this evidence, and that includes consumers, should be involved in the production of rapid reviews as well. So its involvement is enshrined in Cochrane policy. But it's one thing to say that we're going to do that. The way that we intend to do that, we want to do that, means that we have to work in a different way from the way that we normally publish and produce evidence. That's often a very long-term process. Rapid reviews are turned around in a matter of days, and in order to do that, we had to do things differently. So, prompted by a colleague, Luba Litvin from BMJ WikiRex and the Magic app, we formed a task group of people who are champions for involvement, and I mentioned their names right at the beginning. And we pulled that task group together so that we could create the resources we need, the learning resources that participants and volunteers would need, the support that they might need, the peer support to them. We created short how-to guidance, one-pagers of information for consumers and others to explain how consumers could get involved in those rapid in those rapid reviews. We produced very short video explanations for people as well, because sometimes people like to hear that guidance as well. It brings it to life. And we created a web page of resources so that people could take part. So we've put in place all the tools that people need to get involved. And then we've started to recruit volunteers so that when we wanted to particularly to connect with people who have relevant lived experience, perhaps who have had COVID-19 or who have family members who've had it or are affected in other ways, perhaps they're particularly at risk or affected in other ways with other conditions. And so we set about recruiting those people. We were careful not to recruit too many people. We didn't want to raise expectations beyond which we could meet. But we wrote a blog post and wrote out to our consumer community. And we created an online form so that people could sign up to volunteer to be part of this important process of producing the evidence that people need. So could I have the next slide, please? So to date, we've recruited 100 volunteers from around the world. The first review that we connected a consumer with, and that was an experienced consumer in the Cameroon, was about interventions to improve access to food in low and middle income countries. So that's the very first review where we were able to connect a real person with research. And that's a matter of great, it was a great moment for us. Since then, we've connected 17 consumers around the world with 13 reviews, 13 research projects. 4 of those are working with author teams to produce the research, and the others are acting as peer reviewers for research that's already underway. We've also been able to connect consumers with some of our other partners' activities, and that's a piece of work that I hope we can do more of. It's important that we reach out to to other people and work in partnership. So that's something that I hope we can do more of. Right now, we're developing the way that we evaluate this work. We're extending the range of tasks. You know, with 100 people, we want to give people more ways of contributing, and so we're looking at how we might do that. And we intend to publish our work as well, so that it's, you know, transparent and that we can share our experience with the wider research and patient community. Next slide, please. So right at the end of my brief presentation, I was thinking about the 10 factors that I think helped us to create this, what I hope is a successful process. So, I mean, these 10 things, some of them are quite obvious, really. I mean, this is such an issue of importance for people around the world, and that's energized us. It's given us the impetus to do something that would have, under normal circumstances, would have taken a long time to do, I think. So the fact that it's such an important global priority at the moment has been important for getting this underway. But it's also built on the sustained investment in relationship building over many years, since 1994. We've been working to build that community. So I think that's important, that sustained relationship building to enable these things to happen. It wouldn't have happened without leadership at a senior level, at Cochrane board level, and that's given that set the tone, really, and a culture for involving people generally, but also in this particular way in rapid reviews. I think another thing that's been important is that consumers are embedded in the governance of Cochrane, so they're part of this whole enterprise and have a voice at the table. I think that's been very important. The other thing that has been crucial was the fact that there were people within the wider Cochrane community and outside it who were champions for involvement. So, for example, that group of people on the task group were enthusiastic and responded so quickly and helpfully. So that's been really important to build a network of champions who support that work. We also had infrastructure to be able to deliver this work. And I think, you know, you can't, it's very hard to start from scratch. And so, you know, we have things that you take for granted, websites, databases, social media, and so on. Important to build an infrastructure. We had resources that we could repurpose. So we've had learning resources that we're building up for some time, and we were able to point people in the direction of those and give people an opportunity to learn as they take part. Those resources are underpinned by research. So we've been able to do some of that research, which explores how patients can be involved in evidence synthesis. And I think, so that's really important that we do the research that informs the way that we work. And we need to do more of that, but that's helped. The other two things were that evidence synthesis is a little bit different from some other kinds of research. It's a very focused, processy kind of research. That's helped us to define clear roles for everyone. That's for the patients that get involved, the consumers that get involved, and for the researchers as well. So it's very clear, and we defined that in this process even more clearly so that everyone is certain how they can add value to the piece of work. And then finally, I guess I would say this really, that Cochrane has invested in the staff to deliver it. You know, they employ me and some of Oliver's time as well to do this work, and that is absolutely key. If you're going to do involvement, that you have to invest in it. So those were my 10 factors for success, and I think there might be one more slide just to say thank you for listening, and please do pick up those links and also contribute on Twitter right now, if you have anything to say, and submit your questions. So thank you, everyone. That's it from me.